Hello everyone, my name is Akira Higuchi from CogSmart. In this session, I'd like to talk about what CogSmart is doing for the dementia prevention and reduction of care burden. This may be the first time for you to hear the name of CogSmart. So let me explain first. CogSmart is a spin-off company from Tohoku University in Japan. And also, it has a universal institution called as the Institute of the Development, Aging, and Cancer. Its abbreviation is the IDAC. This institute is doing the developing cutting-edge prevention, diagnosis, treatment methods, and innovative medical devices. And also, we aim to overcoming age-related brain and neurological diseases such as dementia and interactive cancers. CogSmart was founded in 2019 in order to embody the research outcome of the IDAC of Tokyo University. One of the co-founders is a professor of the Tokyo Universities, and we are providing our services, reflecting the cutting edge and latest research outcomes of the Tokyo University. Our mission is keeping the lifelong healthy brain for everyone. This doesn't mean only the prevention, but also social inclusion for dementia patients as well. I will explain further later. So today, I'd like to talk about 3 points: background on dementia in Japan, and the second is latest strategy and technologies from early screening to prevention, utilizing our services and products. The third one is example of implementation in local Japanese communities. So first, background on dementia in Japan. So this is a worldwide view on the predicted prevalence of dementia. So burden by dementia is increasing. You can see Europe slowly increased partly thanks to the prevention strategy. But on the other hand, in Asia and in the Americas, the number of dementia patients are anticipated to be more than double, or around 3 times. And the social cost, the scale of the societal cost cannot be ignored as well. All are more than 1.8 or 1.4 trillion US dollars in 2050 if we wouldn't do any of the preventions. So this may be familiar to you, but in 2024, the well-known Lancet Standing Commissions updated the risk factors for the dementia. First, 2019 was the original, but this year, update was published. And you can see there are some risk factors from hearing loss, cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol. This is a risk factors from the middle life, and also late life. You also have to keep in mind societal isolation, air pollution, visual loss would be dementia risk factors. In total, 45% risk factors could be prevented or delayed by addressing these 14 modifiable risk factors. Currently, this is a common thought on the dementia researchers, as long as I understand. So we are now targeting how to mitigate these modifiable risk factors. In Japan, mindset revolution to dementia is changing. Before 24, probably you can see these Chinese characters. So this is pronounced in Japan as Chiho. Chiho is a kind of a stigma and misunderstanding leading to discriminations. In 2004, so this Chiho changed to the word of the認知症. This is a dementia. At that time, early discovery and support is also sought. But in 2015, in 2015 or around, dementia also aimed for the prevention. And this is called as the Orange Plan in Japan. And dementia prevention is one of the policy how to tackle the dementia issues. And in 24, this year, so inclusive society is also added to the dementia policy in Japan. In last year, so Basic Act on Dementia was enacted, and from this year, this got effective. So this is called as a Basic Act on Dementia to promote an inclusive society. This is a law to support society as a whole, so that people with dementia can live with hope while maintaining their dignity. What is important is we are advocating how to prevent the dementia by mitigating the risk factors I explained. But on the other hand, this is the two sides of a coin to reach to the inclusive society. Inclusive society means people with dementia can live with hope while maintaining their dignity. I think this idea has already spread in Hong Kong as well, when I heard from my colleagues. But in Japan, we are also focusing on both of two sides of a coin as a dementia strategy. By the way, in Japan, there are some words of the Mibyo. So let me explain. Example of the local government's action to prevent diseases. Kanagawa Prefecture is the second largest prefecture in Japan. So southern area of the Tokyo. So you may think that disease or health or sick or healthy, but when it comes to the chronic diseases or the dementia or psychological diseases, there is an area of the Mibyo before, so getting the sick. In order to promote the healthcare service for disease prevention, so Kanagawa Prefecture, so certifying outstanding healthcare products and services as Mibyo brands in order to improve at this stage as much as early as possible. For example, so providing the vouchers for certified goods and services eligible returns to those who spend donations to Kanagawa Prefecture. So this is a tax reduction. And so CogSmart's two services are certified as a Mibyo services. So this is a governor of the Kanagawa Prefecture. But so we are promoting these Mibyo ideas as well. So there is so our latest strategy and technology from early screening to prevention. So CogSmart strategy is, so I express from the midlife. So there are risk factors for dementia. And what we are doing is to give the early discovery for the early prevention. And even though you got elderly, you can do the prevention or delay of the progression. So we are so targeting the prevention area. On the other hand, we are also targeting the inclusive society for the realization with our technologies and our stakeholders. First, we are targeting on the hippocampus. This is a well-known areas because severe atrophy on hippocampus is so recognized when you are so seeing the dementia patients. This hippocampus is a part of the brain, very tiny deep brain area. Diameter is 1 centimeter and length is 5 centimeter, as tiny as little finger. Deciding whether new information is worth keeping or not to you. And the morphology on the slight changes reflects the future risk of the dementia. Hippocampal volume, so HV, and its significance, let me explain. This HV at any age group is associated with the future risk of the dementia. Age group HB correlates to the aging. When you get aging, hippocampus volume is shrinking. But HB is not only influenced by genetics, but also by lifestyle, which I explained for the 14 risk factors. HB can be increased through neurogenesis by specific intervention, especially for the aerobic exercises. This is really great. So neurogenesis only occurs in the hippocampus areas. If you endeavor, you may increase or you can improve the atrophy of the hippocampus. In Tokyo universities, we have a large data set of the MRI images and also hippocampal volume data sets. So we identify the normal range of hippocampal volume in the healthy adults at each age group of the Japanese from 20s to the 80s. Well, this is a great data set. Cross-sectional data is more than 3,000, and also longitudinal data is 400. This means we are tracing the 400 identified subject with the identified MRI scanners, and we can check how gray matters or the hippocampus volumes are changing for the 8 years. These 8 years longitudinal data, as long as I know, cannot seen in any other academia except for the Tokyo University. And also we have the technology of the AI. So we have the AI technology, artificial intelligence software to measure hippocampal volume fast and precisely. And this is published in the peer-reviewed journals, such as medical image analysis. Based on these technologies, CogSmart are utilizing this brain seed product and brain app product in order to achieve the lifelong healthy brain cycle. So let me explain how we are spreading this idea with the hospitals and also the cities. So this AI artificial intelligence, we have the key 2 points, segmentation and also data comparison. Thanks to the artificial intelligence, we can provide the clinicians with reliable results and lessen workload on mundane tasks and improve clinical productivity and less time required, 1 to 2 minutes. As to the data comparison, we have a large data set. So we can compare your data with the population data, and we can evaluate more subtle differences of the hippocampus volume changes. Advantage of the modern AI technologies. So our AI technology has 2 points, 2 features, stability and speed. So you can see the figures, but let me briefly summarize that. So we can, of course, do the same inputs come with the outputs. So dealing with the inevitable image blurring. So blurring means if you are checking, sometimes MRI's data are blurring, but this AI studied how the scope of the hippocampus. And even though there are some blurring, AI learned blurring variations of the brain image. These kind of the significant data results are in the published in peer-reviewed journals such as medical image analysis, and those by other universities and medical institutions. So we also guarantee the transparency of our AI. Our services are adopted by 90 hospitals and clinics in Japan, including the Toranomon Hospital, which is a leading hospital. So also National Public Service Mutual Aid Association Hospital, and also university hospitals such as Mita Hospital or Nippon Medical School hospitals from the small clinics in the local areas. What we are doing is, first we are getting the MRI acquisitions. 15 minutes or 10 minutes scanning. And then with 1 minute, you can upload and analyze brain image on Brain Suite. And report will be generated within 5 seconds. So each clinics and hospital can install very easily. And also simple and quick process. You can utilize this AI analysis and get the reports, whether your hippocampus got atrophy or not due to the lifestyle traits. And we are providing the personalized reports like this. So with the hippocampal volume and the prediction and where you are positioned. So this report is easy to understand for the patient with graphs and plain explanation. And medical professionals can follow the trend of the patient data to guide them to more personalized and efficient prevention of dementia. But this is just a check for the dementia risk. So we are also providing the brain app, data therapeutics apps to help increase vocabulary volume, and also dementia mitigation. So this is utilizing smartwatches or other IoT technologies. So there are 3 points. First, prevention of dementia. So thanks to the lifestyle traits improvement, especially aerobic exercises with mid intensity, you can enjoy vocabulary volume increase, cognitive function improvement. And also second is a reduction of the care burden. So prevention of the frailty and stamina will be up and carer support will be so achieved. The third one is the promotion of support by family and society with better social interaction with physical activities. And also we aim at the quality of life improvement assisted by IoT technology with AI. So this is target not only for the middle life stage people, but also for the elderly people, even including the MCI patients. We also got the good clinical study result utilizing this brain of target 120 subjects resulted in evidence showing increase in hippocampal volume with cognitive function increase following guided interventions. We are now doing the further clinical studies, so including pragmatic trials with cities and towns. So you can see the change or improvement in the hippocampal volume and also cognitive functions by this study, but we are doing further. So this is the last session, slide of the example of the interpretation in local Japanese communities. Have you ever heard of the name of Mitaka City? But you may have the name of the Totoro. Mitaka City is well known as hometown of Totoro. Its population is 200,000 residents. In Tokyo, it's this kind of the figure. So, and we are now doing the Tokyo Metropolitan Government project targeting the Tama area, including Mitaka cities, how to change the society, how to change the society to the inclusive society. So we are doing the plugin trial because usually intervention study or randomized clinical trial or randomized clinical study is only in the academic papers. But what is required is how this kind of the academic result will be scaled in the real world. So currently we are targeting 2 segments, early prevention for the age 20s to the 74, and also promotion on inclusive society for the 75 years old. The goal is we are now spreading to the health unconcerned group or health indifferent segment by doing the community-wide intervention study. The goal is to realize feasible models to implement the dementia prevention in real life with local governments, and also as to inclusive society to realize dementia-friendly town Mitaka, along with Basic Act on Dementia 2024, as I explained earlier. To realize inclusive society with stakeholders, Mitaka City has the 7 community centers as Hong Kong society has, I think. So we are strongly collaborate with Docomo, NTT Docomo, a big infrastructure in Japan, and Nomura Real Estate with its fitness club, Megalos, and also other fitness clubs, electrical appliance stores, smartphone stores, grocery stores, shopping street association, carers clinics, of course, and insurance company. These stakeholders are supporting the real world communities. So we are collaborating together in order to approach to not only to the health conscious people, but also health unconscious people as well. So this is the last remark. So please visit Japan and experience this lifelong healthy brain. So we are providing comprehensive package and services are now available for visitors in Tokyo metropolitan areas and neighboring tourist hotspots such as Hakone. So you can see the Fuji and enjoying our brain prevention services as well. So thank you very much for this presentation. Thank you very much.
Thank you, Higuchi-san, for your detailed explanation on how CogSmart is used in dementia prevention and contributes to the reduction of care burden. Now, we have two guests in our room. Hello, Higuchi-san, and also Shota Nakamura-san. Hello. Okay,
Hello.
Let's take a look at the questions raised by our audience. The first question is, thank you for the presentation. Can you explain more on what that we can expect from the Brain Suisse reports?
Okay, thank you very much for your questions. So as Brain Suisse shows, the shrink atrophy level of the hippocampus volume. So among the same generation and the same sex. In my case, so I'm now 41 years old, but thanks to the big data of the Tokyo University and other data, so I can compare my hippocampus volume among the same 41 years old and the man. In this case, you can understand, so hippocampus is getting atrophy. So when you are getting aged, but due to the bad lifestyle traits, the atrophy may get more severe. So you can do the behavioral changes based on this atrophy level with our questionnaire. So Shota Nakamura can explain how the people actually change the behavior, do the behavior changes.
Okay, thank you. Thank you for the response. Let's move on to the second questions. Can the Bring Up app be complied with all kinds of smartphone and smartwatch?
Theoretically, this is yes. But at this moment, so we can use both for the Android and iOS app, But currently, as to the smartwatches, we can use only for the Fitbit and also Apple Watches for the elderly people. So we would like to expand to other watches, such as Garmin or Huawei.
Okay, I see. The third question is, do you have any statistic on the results of the checkup and the app functions on dementia management?
Yes, so we are doing the clinical studies, as I've explained during the presentation. So Shota may add more details, but frankly speaking, concisely speaking, we can show based on the clinical studies with 120 subjects, so we could achieve the cognitive functions increase together with the cancer volume increase, together with other lifestyle traits scores increases with a statistic p-value. So we are now proceeding another clinical studies in order to show more effects with the app. So Shota, if you have anything to add, so please add.
Okay. So the clinical study that we conducted is a phase 1 study in the development of a DTX application, brain app. And what we found from the clinical study is, as Akira mentioned, due to the use of brain app, people can increase the volume of hippocampus, and not only that, people also get short-term memory improvement and other brain function improvement as well. And also, one point that should be noted is not only the brain function, but also diabetes was also improved in HbA1c. So meaning that the use of brain nap is contributing not also brain function, but also general health status.
Okay. The next questions. Could you share more information on the Mikata City project? For example, on how the program is rolled out and how the local partners, such as the real estate company, fitness club, or smartphone stores contributed to the inclusive society in Mitaka City? This is a big question.
Okay, thank you very much. So in the Mitaka City projects, one of the aim is to how to share our ideas and also these services to the citizens. In the case of the clinical trial or clinical studies, so we can get a strong evidence, but some criticizes that this is a kind of artificial. I mean, so some subjects with a high awareness are joining the clinical studies. But so this often happens that although clinical studies may show a good result, but it is different from whether we can spread our services to the society. So here, in the usual circumstances, so these companies are introducing cognitive functions test services or other services to the citizens. And in the ordinary lives, so they are enjoying checking how to check their cognitive functions and also how to improve their lifestyle traits and then cognitive functions or prevent the dementia risk. So what we are doing is how to embody our services in the society. So we are now checking with doing the POC with the Mitaka cities now.
Thank you. So it is very important for different parties to collaborate in the community to achieve an inclusive society. Okay, let's see the next question. Are there any numbers you can share with us on the progress of this project?
Sorry, any number, sorry. A moment. So yes, we are now setting some KPIs on it. So Mitaka City has 200,000 populations. So for example, one thing is, to what extent people are using our services and then complete or achieve the behavioral changes. This is one of the one KPI. So we are not setting the absolute numbers, but this is a kind of good numbers to be achieved. And what is important is how to scale our services to other communities or other cities as well, not only in Tokyo, but also other prefectures. So we are now creating the good best practice. So depending on some regional differences, but short-term may add some of the ideas. So after doing our project, we would like to also share our ideas to the other countries, including Hong Kong. So yes, Shota, if you may add something.
The numbers is not easy to answer, but what I want to say is the best practice in a local government is a key point in this project. Mitaka City is a kind of average city in Japan, and if we succeed some models to dementia prevention, then we can copy and other local governments can copy, so that the Japanese citizens, all of the Japanese citizens can get the benefit of this trial, this project.
Thank you. Thank you, Higuchi-san and Nakamura-san, for your sharing. Thank you so much. We hope to visit you in Japan one day to learn more from you. So we will.
Thank you very much. Yeah, we look forward to welcoming you.
Okay, see you.
Thank you, everyone. Thank you for sharing.
Thank you very much.
Hi, I'm Alison Harrington, the CEO and founder of Resparke. And today I'm really excited to share with you the Resparke platform and to take you through how we actually make transformational change in dementia care. So there's a couple of components to my presentation, telling you a bit about Resparke, the organisation, taking you through the research and benefits, and then really taking you through how it actually works for dementia care in practice and sharing some applications and case studies. So Resparke, we're an Australian organisation, and we have an evidence-based dementia care and wellbeing technology to be able to enable staff to provide person-centred care really efficiently. And so what that actually means in practice, there's two benefits. One is for the person living with dementia in creating these immersive moments of connection and joy and meaningful engagement. And the outcome of that is that it is reducing some of the changed behaviours with dementia. And also the second impact with our program is that it actually is a really valuable tool for carers in increasing their job satisfaction, making their jobs easier to do, and really creating a better quality of life for residents in care. So our mission as an organisation, you can see this wonderful photo here of one of our residents who's using the platform, is really just to improve the wellbeing of the elderly in general. And that's been, as a founder of the business, that's been something I've been very passionate about in how we're actually able to use technology to do that. We're in over 280 aged care homes across Australia and New Zealand. We've engaged with 10,000 different residents. We've coached over 2,000 staff. And we're in a lot of organisations in every state, including really big organisations and also small organisations in regional and rural areas. So the business has been operating for probably about 4 years, and over that time we've had a very strong research partnership across different universities, but the major university we work with is Australian Catholic University, ACU. And it's been very important for us to be, as we've been evolving and developing the program and the product, to be able to prove the effectiveness of the program. And I'm just sharing with you now some of the results of some of the various studies we've done across the last few years. One of the points that we're constantly, I guess, innovating in is how easy this tool is for staff to use. You can see one of the studies is demonstrating the increase in staff job satisfaction in being able to use the program and make their jobs easier to do. And I'll take you through some of the ways we're doing that for daily living further in the presentation. The other one is just really improving the mood of residents living with dementia and being able to change behaviour and to reduce anxiety, agitation, those types of things. We've also been working a lot in palliative care and how we use this as a tool in palliative care. And the study on the far right is really how does this tool used as an intervention instead of a psychotropic drug intervention for some of the change behaviours. And we've been doing ongoing research with some of the more clinical studies we've been doing with clients. And I just want to show you this study, which is also a very recent study, which we presented at the International Dementia Conference. It was a study across 2 homes as part of an ARIA grant, showing that for mild or moderate behaviours, Resparke was effective in 97% of those cases. So, and this study, I've got a little video to show about this study. This study was also done in New Zealand, in Somerset, New Zealand, where we work with their karaoke, their volunteer teams in New Zealand, and being able to use Resparke to improve wellbeing and also to affect change in behaviours of residents. So you can see on this chart here what the state was before the session started and what the state was at the end of the session across 250 sessions. So you can see on the left-hand side, there was a whole load of what their I guess their mental state was, what the behaviour was. You can see confused, lonely, sad, worried, happy. So you can actually see the change that Resparke had on those sessions. And what I want to do now is just share with you a little bit of video about the impact of Resparke at this home in Somerset in New Zealand.
Hi, I'm Linda. I'm a kaitiaki here at Somerset at Karaka. I love Resparke. Some of our families have actually used the headphones with their loved ones and listened to music or watch things with them, or used the information that, you know, mum watched such and such a documentary, that gives them a point of conversation. Here we go. Now let's find your name. Here you are. Yes. That's you. Yes, me. That's you. Shall we have a look at your favourites and see what you like? I thought they would like to. Shall we have some Frank Sinatra? Yeah. Yeah. I believe that Resparke makes a huge difference to people's lives. When I sit down and we get that engagement, it just makes my day. You can see in their eyes, you can see the emotion that the music brings, and the connection and the enjoyment they get out of it. And that's the best job satisfaction you can have.
So as you can see, that's really beautiful to see the product come to life and what it's doing in home. So one of the things that I want to now take you through is, well, how does this all work? You know, we know what the benefits are. We know what the impact is. We've seen it in the video, and I've just demonstrated through the research that we do. So how do we actually do this in practice in the program? So the starting point for us in our program is actually collecting the information about the person. As many of you would know, with dementia care, being able to really offer that person-centered care and to be able to find the thing for that person that works is really essential. So that's actually been really important for us in our life story feature that I'll show to you in a little bit later on. So we can send this form to families to complete, or it can be completed by staff or the person living with dementia themselves. We then build a page for all of the residents on our platform. So those pages are able to be built in bulk when you can upload residents to our platform, or individually one at a time. We then train staff in how to access that page, how to actually use headphones, and headphones for the dementia work we do is really important. We have lots of usage of the program without headphones, and it can be accessible across TVs, phones, tablets. But we find with the dementia work that we do, the immersiveness of the headphones does actually make a big difference. So with the work that we do, so we train the staff in how to use the headphones, and then how to be able to selectively use the program to be able to pick the right content selection at the right time to make that impact. So all of those components have to come together to be able to create the solution. So now I've taken you through the concept of the solution. Let's just kind of look at the 4 components to make all of that happen. As you can see on the left of your screen, you can see our console, which has our tablet and headphones in it. The tablet also comes with a wireless transmitter that can transmit to huge numbers of headphones simultaneously, or we can, in our dementia kits, we offer 2 transmitters, so we can have 2 or 3 different streams running at once. But the program, as I said, can also be accessed on smart TVs, and we are actually installing the program on many smart TVs across Australia in residents' rooms. The second part of the program is the content platform itself, which has thousands of items of content across music, videos, and podcasts, and I'll share a bit more of that with you in a moment. And then our training program, where we're able to do Zoom training, and we also have lots of training modules on our platform. And underpinning that is our life story component, which is where we collect the data, which I previously spoke about. So going now to the components of that program, as I said to you, we have music is a big part of dementia care, as you would know. Music is very impactful. It's been proven to make a huge difference with people living with dementia being able to bypass those elements of the brain that are damaged by dementia and be able to reconnect with those emotions. But we do know that you need to have personalised music, and that's really what the platform is able to do at scale, and that's the work that we've been doing with our music service that we've built off our exclusive deals with Sony and Universal Music that have enabled us to be able to provide a fully compliant and licensed music service for Resparke that dynamically personalises the music. As I said, we also have thousands of videos on the platform across a huge, diverse variety of topics across travel, exercise, tranquility, animals, pets, and we do a lot of work with spiritual and palliative care. We have podcasts. And we also kind of, as you can see on the screen, we also have like a weekly programming schedule so that there's new things appearing on the platform every week. This is just a quick glance at our content, and we have 48 different languages on the platform. And I'm just sharing with you the Mandarin content offering we have on the platform, and just going a level deeper. These are some of the exercise programs we have on the platform for Mandarin. And we also have quite a diverse range of music offerings as well. But what I wanted to show you, which is quite interesting that we're doing with our dementia care work, is the work that we're also doing with assisted daily living videos. There's been a lot of research coming out of the US about how we're able to use slow motion content and videos to assist daily living. And we're training care teams in how to use these videos as part of daily care currently. So we've created a full set of videos for different activities of daily living: showering, dressing, eating, brushing teeth. Many of you may know that particularly things like showering and dining there can actually be in aged care residents who are resistant to care or have anxiety and agitation around these types of daily activities. And we have had quite a bit of success in being able to train care staff. I'll take you through one of the case studies we have in a minute in how to use these videos to be able to prompt before care, being able to play these videos via the platform just prior to the activity. So I'll share with you in a moment how we're using those videos in care. So what I'd like to share with you now is that pillar. If you remember going back to the 4 pillars slide, this was actually the 4th pillar that underlines the whole program, which we're really excited about, which we've just launched, which is actually a life story, which is actually the life story profile. So in this section of our platform, we can generate links that are sent to when a family comes into care. The aged care home can very easily just send automatically from the system, can send a link to the family to be able to complete this profile. This profile can be completed in any order, and it also has the ability for families to upload photos to the profile. So that was something that all of our clients wanted, and we thought that it will have a huge value in reminiscing, being able to upload photos to the platform so that the photos can be played on a slideshow for residents living in care, and can also be used as part of conversation and also part of reminiscing therapy. And I just want to show you a page. This is a resident's page on a platform. This is actually a real person. This is Bob. And it was very interesting that this was actually before we built our new form that we've got now, the one that I just showed you. But this is how the page was rendering. And Bob actually, we were training staff, and Bob actually wandered into the staff training session. And we actually asked him a couple of questions about himself. And he told us that he loved horse racing and he also loved the Bee Gees. So the staff, as you can see with the tablets, were very easily able to put that information in like 5 minutes. And then you can see we've created a profile for Bob, and his information about the sports and his the music he loves was in there. And the green tab is actually our suggested our suggested content tab. That's when our engine dynamically matches a page with horse racing videos and the Bee Gees music to come into Bob's profile. And then the staff can very easily access that information. And the families can also go in and then also favorite even more content for Bob as they get to know the platform better, and he's able to use more meaningful and more engaging content. So when we train staff in how to use the program for dementia care, we ask them to get as much information about the person as possible. The platform programmatically pulls all that information into that green tab, and then the staff are able to go and access that information. That information can also go back into the care plan and is often put back into the clinical care systems. So I just want to take you through now how this program can actually be used in practice across the continuum of care. And these are the types of environments we're working in Australia. We are currently working in aged care, but we're starting to work a lot in Resparke as well, and Resparke being a platform that can be used for people coming in and out of Resparke and in daycare centres in Australia. Obviously, palliative care, it has a lot of application, but more and more we see that the platform also has an application in community, in home care and retirement living. So the concept of Resparke is that someone has a life story that is able, which is about them, which is be able to be transported through this entire continuum of care. These are some of the applications within care that I've spoken about. Some of these, the more clinical types of applications that we're using the program for as part of daily living, but also the more lifestyle applications in terms of either group sessions, individual sessions, and with all of our work with dementia care, it's actually about finding that very meaningful content that is impactful for that one person. So I'm just going to show you, before we finish, just some real case studies about what we've been doing with some of this work. This is actually about Beverly, who actually used to take this particular lady. It took 3 people to shower her, often 45 minutes. And we were working with the teams in how to use Resparke as a solution for showering and to reduce the anxiety and agitation. So now we're actually able to play, the staff have been using a variety of music and also our showering video to be able to play that to Beverly before showering. They usually put it on about anywhere from 30 to 15 minutes and just have her sitting in the room watching the video, often with the headphones on, and then they will come in and say, "Are you ready for a shower now?" And she's going, she then proceeds a lot calmer into the shower and only takes 1 person. So that's been a case study we've been doing in a care home in Melbourne, and they've been able to use the same technique for various clients. And the other interesting application is actually for weight loss. Often people living with dementia, it's actually not sometimes difficult to increase food intake, and because of the noise in the environment in the dining area. So we've actually been using a lot of the music in particular to be able to put that immersive experience on for residents while they're eating. And we have actually seen residents are quite alert, they're more willing and able to consume food, and it's actually quicker for the staff to be able to feed them during meal times, and it's less stressful. And that for the resident themselves, they're obviously getting an increase in food intake. So there's been a lot of different topics I've covered today, but I hope that I've been able to give you an overview of Resparke and some of the work that we're doing down here in Australia in particular. We are in several homes just starting in New Zealand, and we see that this application, as I've said, has lots of different applications within dementia care, but also across the entire continuum of care. So feel free to reach out to us on resparke.com, and if you have any questions, I'm happy to answer them.
Thank you, Alison, for the in-depth sharing on the application of Resparke in creating a human-centered and therapeutic experience for people living with dementia. Hello, Alison.
Hello, hi.
Hello, good to see you. Let's look at the questions raised by our audience. The first question: what specific outcome measures does Resparke use to track improvement in residents' functional abilities and quality of life?
Yeah, well, we've conducted various studies. One of the measures we were using was the Cornell Depression Score that we were doing with our research with the Primary Health Network across Australia to increase the wellbeing measure. Other measures we've used across different studies we've done, and you can have a look at these on our website, is we've actually gone to measure the psychotropics that are being applied before and after Resparke. So we're looking at the medication data. And one of the third measures that we've used in Australia in particular, we need to report incidents in aged care, and we're looking at how Resparke can reduce incidents in aged care, and that can range from anything from falls to aggression. So that's quite a wide range of incidents in Australia that are reported. So those are some of the more common kind of standard measurements, I guess, across the industry that we've used. But we also do surveys, and those surveys are on the tablets themselves. And that's actually survey data that we collect, how the resident's mood is before and then what the resident's mood is after Resparke, and we report that back to the homes as well.
Okay, I see. Okay, the next question. How does the program measure changes in behavior and mood over time?
Yeah, well, we do that through our work with the PHN, and we have a score when residents are onboarded into the program, and we are able to measure that through a survey that the PHN sends out. Sometimes, as you would know, with dementia in particular, it's quite variable. A lot of our measurements are taken in response to change behaviours that we're actually affecting that change behaviour over weeks in specific change behaviours. The wellbeing indicators are different, and those wellbeing indicators are the ones that we're measuring with our the Cornell Depression Score. So those are the only measurements, but I think the key thing for us when we're talking to our clients is that we just know that there's so many qualitative measures that come back through us when the staff are just saying the residents are happier, we're happier because it's easier to do our jobs, the families are happier. So I think there's both qualitative and quantitative measures that we're seeing as the program gains more traction in the homes, more residents use it, and it does actually become a little bit contagious because other residents see people with headphones on and then also want it. So we are, over time, we'll probably do more kind of longitudinal studies, but at the moment it's we're focusing a lot on before and after studies with some of those behavior management.
So with different measurements, we can actually see the changes of the users of their behavior and mood. Okay, the next question. Thanks for the sharing. How do you address the issues on IT literacy for caregivers, and how can this program help those clients with poor eyesight or hearing problems?
Yeah, well, the good thing is, so there's a couple of answers to that question. The first one is with the clients, with what I'm assuming is the residents. The best thing about the platform is that the headphones make the experience immersive. So that means, and we have a lot of amazing stories about being able to hear better, obviously, through the headphones. Our program also comes with a microphone, so the staff can actually talk through the microphone to the residents. With respect to the vision, we are starting to put that on smart TVs. So with the program, they can actually put it on a smart TV if a tablet is too small to use, and we are actually starting to deploy to a lot of smart TVs. The third answer is about the IT literacy of the staff. And in Australia, I think we have a huge variety of staff, and the other big challenge for us in Australia is also English as the second language in terms of the caring community. So we have been very conscious of just making the whole program so easy to use, and that's why the resident profiles are really critical, because we're really training carers to just go in to the platform, look for somebody's name and press the button. We've been training the carers to make sure the profiles are set up so that they are not spending a lot of time trying to find the right thing. We've also made it really easy to use with QR code logins and a whole variety of very easy, posters, flyers, training, help, FAQs. And the other thing that we're doing is translating all our training videos into different languages. And one of the other things I didn't mention in the video presentation is that we are now also we also have translation of daily care, request. Are you ready for a shower? We're actually translating all of those requests into many different languages so that carers can very easily just press the button. I'm speaking to one of the residents who's Italian. I'm going to ask her something in Italian. And as you would know, with a lot of the new technology coming out with AI, it's fantastic because we can use this technology to really make the carer's job a lot easier, and to also connect to the resident in language a lot easier than it has been previously.
So it does take some efforts to design the program that can cater different needs of the user.
Absolutely. Yeah, absolutely. And the usability of what we've had to design, you have to think a lot harder because you have to design for a lot of older people and also for carers who may not be technically literate.
Yeah, thank you. Okay, let's move on to the next question. Are there any plans to conduct research studies on the effectiveness of Resparke in Hong Kong's or Asians' elderly care facilities, considering the unique cultural and healthcare context?
Yes, we are very interested in finding partners in Hong Kong. We've been working in Australia with a nursing home that has predominantly Chinese and Cantonese residents, and we've been doing a lot of localization of content in that context, almost like a mini pilot down here. We've been working really closely with them, and we may be coming up to the summit in November. So if anybody is interested in piloting it, obviously there's specific differences in culture, in content, and context, and that's what we believe we need to do to make the program successful, in a different country. So we would be planning over time, probably in the next year, to be looking at seeing if we can start some type of studies and localization in other countries. And Hong Kong is definitely one of those countries we're interested in looking at.
That's great. Okay, the next question. When users' daily behavior, including showering, are recorded into video, what strategies are adopted to prevent personal data leaking out? Yeah, that's an important question.
Yeah. Well, when we use the video, first of all, we've actually designed the whole program with a lot of security around the logins. And we have built the whole platform on the latest AWS technology in terms of passing security, because we knew that this was going to be something very important, and rightly so. But when we're doing the videos, how that works is that video, it's not a two-way video. So what's happening is a carer is coming down, and usually we train the staff to come and sit beside somebody. They might be in their room, usually on the bed, and it could be that they're putting a tablet on their stand beside them so they can see and watch the video. They're then telling them, would we like you to watch a video about a beautiful shower? So they sit there often, and we've actually been asked in many cases to make, for the lady with the shower, we got asked to then make a hair washing video because the shower video was so successful. But it's a video that the resident is actually watching that video. The video is not going back the other way. So they will then put, once the resident is understanding and accepting of that they're about to have a shower, then they will turn the video, the iPad off, put the iPad down, or it could be on TVs. We are actually now doing this on TVs. And then they will then proceed to have the shower. So we haven't encountered any concerns, definitely not in Australia, about anything along those lines with kind of using the tablets and watching videos in that way from a privacy perspective.
Okay. Let's continue the question. Can you provide more details on how Resparke's music and video content is used to improve food intake for residents with dementia?
Yeah, it's really interesting. And we have been trialing this because one of the biggest things, as I said in the video presentation, one of the biggest things that we hear from our clients is that daily activities like showering and dining can be actually quite stressful for certain residents, not for all people living with dementia. And because the dining experience is very loud, noisy, there's lots of other things going on, so they can become agitated. So we put the headphones on, we work out what music is right, so they are then immersed and it's blocking out all the external noise so that then they can focus and they're not as agitated with eating. That is one scenario. The other scenario we have is where people are very, I guess, not awake, that they're very subdued, and it's hard for the staff members to make them more alert to get them to continue to eat. And the staff members are sitting there feeding them, and it's time consuming, it can be very challenging, and they're really not eating a lot. And so what we'll find then is we put music on that is very uplifting. We have to get the right music for the person, but it's actually increasing their mood and making them more alert, and they actually intake more food in less time. And that's definitely been a strategy we've had several clients have a lot of success with, and it's really for Pacific residents. And the other effect in the dining hall is if those one or two residents who are agitated are better managed, there's not as much stress, it's actually better for everybody else around them, and everybody has a much better dining experience. So yeah, it's been very interesting with the food intake, and we actually do want to do have some research data on that, and we're looking at working with a home to be able to substantiate that with their own data from a weight perspective in how we can use the program to do that.
Thank you, Alison, for your sharing on the practice and experiences in Resparke. The question is all here, so let's keep in touch. Yeah, and thank you again for your sharing.
Thank you. Thanks a lot.
See you.
Bye.
尊敬的各位专家、各位来宾，大家好！非常荣幸受邀参加 GIES 的会议交流。我今天和大家分享的内容是认知障碍全程管理实践及数字化技术应用。也许我们想过，有一天我们老了最想要什么？也许我们有的人还没有想这个问题。那我想跟大家分享的故事，这是一位我曾经管理过的认知障碍的老人。他无论是坐在轮椅上，还是躺在病床上，脸上总是有一种非常轻松的笑容。为什么呢？实际上，他教给我认识一件事情：认知障碍的老人可能会淡忘他所经历的故事，忘却他眼前的故人。然而，一段音乐、一张照片、一个微笑、一次握手，都可以让我们和他紧密连接。正是这种连接，让他感受到了尊严，也让我们看到了他脸上轻松的笑容。另外一个故事是一位社区的志愿者，他需要照顾家里长期卧床的老伴儿，但是他一直热心于社区的志愿工作，帮助打扫卫生， 帮助张罗很多社区的活动。他告诉我们，最开心的是志愿的过程。其实计算是做一件小事情，但这个过程让我很享受。我为他们做了一件小小的事情，但是只要他们觉得满意，他们脸上有笑容，我就觉得很自豪，很满足。这个老人告诉我们的是，他只有长期参与社会的活动，他才能感受到内心中的满足和心里的愉快。实际上，无论是尊严还是社会参与，无论是认知障碍还是他所感受到的心理愉快，都是精神心理健康的内容。精神心理健康是一个很大的范畴，包括身体、认知、心理、社会以及和环境的互动。所以，我们今天要来谈论认知障碍的全程管理，那应该把它放在精神心理健康大的范畴来理解它。老年人认知的问题挑战的确是非常大。以2021年世界阿尔茨海默病报告就曾经显示，全球大约有75%的重度的认知障碍患者是没有得到诊断的。我们国家调查的数据也显示，农村地区能够得到过重度认知障碍，也就是很多人说的失智症或者是痴呆，它的比例呢也不到10%。我自己也曾经带领过国内的记忆门诊来进行调查，就发现很多的家属注意到患者有重度认知障碍的症状或者是痴呆的症状，但是并没有及时带他们去就诊。如果从延迟的时间来计算的话，大概平均会延误2年左右。有2/3的家庭会在症状出现1年以后才去就诊。40%左右的家庭会在症状出现1到3年以后才就诊，有10%的家庭在症状出现5年后才就诊。可见这类患者的问题并没有及时得到帮助。那么我们也曾经去看，到底这样的就诊情况有没有什么挑战？我们在大陆地区进行调查就发现，城市和农村的阿尔茨海默病患者就诊的情况并不容乐观。甚至有很多人会出现去其他地方就诊的这样的一个现象。所以说，我们诊断不足，治疗也不足，因此我们要去解决的挑战就非常的巨大。与这巨大的挑战所形成对比的是，我们其实存在着很多服务的痛点，包括全程管理的资源配置是不足的，可能在大城市主要的地区会有这样的资源，但是并不是绝大多数地区都能够配备起完整的全程管理的资源。第二方面，能够为认知障碍的老人，包括其他提供老年精神心理健康服务的老人的服务类型是比较单一的，并且呈碎片化。以曾经我们做过的内部调查就发现，可能很多团队关注的都是认知筛查，但是筛查以后能不能够进行跟踪的诊断，诊断以后能不能够给他提供全程的药物和非药物的干预，以及是否关注到照护者的照护压力，这样相关的服务呢是少之又少。那除了这个以外，我们其实也发现，尽管有的地区可能已经有全程管理的资源，但是人们真正去使用这样资源的比例又是不足的，所以很容易就造成服务提供方和服务使用方之间的一个壁垒。为了去打破这样的壁垒，让人们能够充分的利用手边现有的一些资源，我们就需要去把相关的服务去做一些拓展。为什么呢？其实已经有文献就发现，我们的社会环境和精神心理健康是有关的，当然也和认知功能是有关系的。比如说，有研究就发现，生活满意度越高，脑龄就越年轻；参与社会活动越多，认知衰退的风险就会越低。同样的，如果社会网络越丰富，健康的自我评价以及生活能力就会越好。因此， 在我们的服务中，会强这样是不是真的是有可能带来帮助呢？其实有研究就发现，老年人的精神心理健康问题，包括认知下降的风险，实际上是在一定程度上可干预的。例如，研究就发现，经常锻炼大脑可以延缓认知衰退，鼓励老人家参与积极的、有回报的生活，是可以改善抑郁情绪的。如果能够给他做一些情商干预的这样的技术呢，实际上也能够帮助老人恢复情绪，提升情绪的恢复力，改善负性情绪。因此，这些资源呢，就告诉我们，可以用尽各样的方法来帮助提升和降低帮助提升认知表现，降低认知下降的风险。那么，如果要动用到社会资源，我们就必然要去关注老人家自我、他的家庭以及与社区和医院的联动，因为这样才能够帮助我们去应对患病的普遍性和资源不平衡的矛盾，才能帮助我们去解决治疗周期长，如果有疾病的话，治疗周期长，费用又跟他的家庭收入之间可能没有办法完全权衡的这样的一种矛盾。当然，在这个过程中，也会让我们有更多的机会去考虑我们传统的家庭观念以及照护形式方面的选择，这样的一些相关的因素。所以我自己以及我的团队呢，也是积极的去推动这样的一种全程管理的方式。那么我们这种全程管理方式呢，实际上是经过了很长一段时间的这个探索和总结的。那么从最早开始呢，去研究社区的老年人精神心理健康服务体系，直到现在，我们能够有落地到社区的老年人身心健康的整合性管理以及认知障碍的全程管理的这样的做法。那么这中间呢，已经经历了10多年的时间。所以在这样的服务过程中呢，我们也越来越多的总结和提炼出了认知障碍的全程管理。那么真正要去做好全程管理，又有利用社会的资源，实际上我们就可以利用社会处方的形式。在社会处方的框架中，我们以老年人群作为中间的核心，通过对他进行全面的评估，了解到他在健康服务方面的需求，尤其是像我们讲认知障碍的时候，我们会关注到整体的精神心理健康的服务需求。那么基于这些需求，又利用现有的一些服务资源包，我们可以去提供相应的一些服务，比如说做好慢病管理，就改善他的身体状况；提供团体的心理疏导，就可能有助于改善他的情绪。如果能够去做一些认知激活和训练干预，那么就是直接的在认知方面呢，给他进行促进作用。当然，外围我们也需要很大的社会环境的支持，包括开展健康促进活动，动员更多的志愿者，建设友好的社区，以及呢，我们能够去优化照护环境，这些呢都是有助于我们推动认知障碍全程管理的。那么只有做这样的工作呢，才能够让老人家以他为核心，形成他生活圈内的闭环，因为我们可以动用他周边的资源。比如说，动用社区里面的联络协调员，包括社区干部和志愿者，同时结合在社区服务的社会工作者和心理工作者，再加上医学专家的一些支持和指导，就可以使老人在综合评估、制定方案、实施干预以及到最后的效果监测方面呢，都可以享受到生活圈内的闭环服务。那么这种闭环服务呢，如果落实到了我们认知障碍全程管理的内容中，我们就可以看到，实际上它就可以覆盖着在社区通过对高危人群进行宣教和筛查，有助于我们去识别认知障碍的高危人群。对于健康人群来说，我们也可以发现他认知下降的风险，并且提供预防的策略。对于可疑有认知障碍的人，那么就可以建议到记忆门诊来获得科学的评估、规范的诊断， 并且呢能够有系统的得到个性化的管理方案的支持。之后呢，再通过多学科的团队，可以为患者去提供药物治疗和非药物干预，并且能够进行长期随访，这就是有利于去贯彻和落实诊断后支持的内容。认知障碍患者的管理中，还有一个特别不可缺乏的人群，就是他的照护者。所以长期为照护者提供支持，包括为他们赋能，提供心理社会支持，也是认知障碍全程管理中非常重要的信息。所以呢，我想在这样一个过程中呢，我就和大家来分享一下我们北京大学第六医院一些具体的实践。当然，现在有很多的实践做法，我们也已经推广到全国很多地方。北京大学第六医院呢，实际上最早可以说在认知障碍全程管理的探索中，是从2000年真正开始的。因为那一年我们建立了大陆地区的第一个医患家属联谊会，真正启动了照护者的团体支持。之后呢，我们通过研究去了解患者和他的家属对疾病的认识，进一步帮助我们去理解促进脑健康的重要的意义，同时也帮助我们去推动在社区里面促进大脑健康，同时基于社区来为照护者提供支持，把我们的家属联谊会也搬到了社区里面开展服务。那么随着社区里面工作的不断推进，我们也意识到了在认知障碍患者后期管理中离不开照护机构，所以呢，我们又进一步把研究的内容呢向照护机构进行了拓展。那么这么多的服务实践以及我们的工作总结呢，也曾经出版了全套的记忆健康进社区的丛书。那在记忆健康进社区丛书里面呢，我们特别强调了管理中的几个步骤。首先是要做记忆体检，让人能够在记忆门。那么记忆门诊我们都知道，看每一个病人其实很花时间，我们又需要很多的检查，所以呢，我们就开发了一系列的数字化产品。包括筛查的时候，在社区里面利用小程序来进行认知功能的筛查。其实认知功能的筛查过程中，我们也加入了一些比较细致的评估内容，包括认知能力、精神行为症状以及生活能力。那如果这些发现了异常，觉得还有必要去进行进一步诊断和鉴别诊断的评估，我们就会把它推荐到记忆门诊去进行全面的认知评估。那现在呢，我们也开发了基于平板的全面认知功能的评估，6个维度的测验，我们都有专门另选。那如果呢，这些也发现了异常，对于临床医生来说，就有必要对它进行诊断。那么诊断的时候又需要一些其他的技术，比如说影像学的技术。那大家都知道，影像学技术就更是离不开数字化了。包括呢影像学数据的识别，还有包括呢这些数据的整合分析。既往呢我们都是按组别来研究，其实现在呢我们影像学数据已经可以进行到了个体化的数据分析，这样对我们临床诊断就可以有很大的帮助。那获得了诊断之后呢，我们就要为患者提供诊断后的支持。比如说我们需要他进行认知训练，需要他进行身体锻炼，所以呢，我们在过去几年里面也开发了一款基于手机小程序的趣味健脑游戏。每个人只要用手机扫描这个趣味健脑游戏的二维码，就可以直接进入到这个意志训练的界面上，根据自己的要求，根据自己的情况来进行呢选择相应的这个游戏来进行训练。那么我们也知道，很多老年人，尤其是到了比较中重度的老年人，他也不出门，甚至可能长期坐在轮椅上，躺在床上。那么我就记得呢，曾经有家属就告诉我说，王大夫特别希望你能够也关注这个人群，让他们能动起来。所以呢，我们在疫情期间就结合以前的实际我们就开发了一款跃动益智操。现在这套操呢，也是在网上就可以有视教视频。我们就发现呢，即使是坐在轮椅上，他也可以跟着音乐，跟着律动的节律来进行训练。 那么很多人一开始可能连手都不举起来，见到周围的人眼睛完全是无神的。但是经过了这个操的训练，他跟着音乐，他有可能会动他的胳膊，有可能会踢他的腿，甚至呢可能在做完这套操之后，开始跟周边的人会有所交流。所以这就是数字化产品给我们带来的帮助。的确啊，像这样的操的推广，我们靠一个人一个人教很难，但是通过数字化技术就带来了很大的进步。那么同样的，我们也要对每个个体，因为每个人的干预都不太一样，所以在我们的微信小程序里面，我们又嵌合了很多新的内容来进行个性化的干预。比如说，这个人他对疾病认识不足，他的家属我们发现对疾病不了解，我们可能就会给他推送一些科普资讯，那就会通过我们的小程序链接到了外部已有的资源。比如说，腾讯开发的银发脑动力就有很多的这样的科普内容，那么我们就一个链接点进去，就可以把这个科普内容给他选择出来，推送给患者和他的家人。那如果说我们要让他去做意志训练，我们就可以给他推送趣味健脑的链接，然后呢，他就可以直接进入到趣味健脑的小程序的界面来进行进一步的训练。正是因为有这些数字技术的不断联动，使得我们能够给患者提供更加完整、全面的全程的管理。那像刚才我举例子说，跃动意志操这样特别适合于我们坐在轮椅上的老人家的一些活动，其实我们也在腾讯合作，像真的这样一些动力。那我们需要给受者提供支持。这是9月21日世界阿尔兹海默病日上，我们的家属联谊会呢又进一步拓展到了全国50个家属联谊会。我们启动了认知障碍患者家属支持及身心健康关爱的全国项目。在这个项目中，我们建议的内容不是很高，但是希望大家都做到的就4个1：参加一个照护者支持群体，学习一门照护课程，比如说世界卫生组织的在线课程，每年进行1次身心体检，每天陪伴患者进行1小时的认知训练。这1小时不仅有助于患者，也有助于他自己。那以上就是我的分享内容。我非常感谢过去很多的学会和协会给我提供的支持和帮助，也感谢腾讯技术公益对我数字技术的开发带来的帮助和支持。那感谢 GIES 对我的邀请，也特别期望今后能够和我们各位听众、各位观众能够形成合作，共同促进老年认知障碍的管理事业。谢谢大家。